Okay.
So welcome everybody to the 2021 open enrollment. We're going to review the changes to the health benefits. Well, that's not accurate. So open enrollment did start today and it's going to terminate till the 16th of December. So very important to note that the 16th of December is when the open enrollment terminates for everyone. So we need the enrollment form submitted by everyone, and I'll go over that in the next slide. I'll bring up the enrollment form so everybody knows what needs to be completed. So the enrollment form that we need back from everyone is here, and this is part of the invite that went out. So this is what needs to be submitted by next week. The sooner you get it to us, the sooner we can process the changes. So that's the enrollment form that everyone needs to complete and send to us. Housekeeping items, just a few reminders here in regards to eligibility, who is eligible for benefits. So all employees who've met their pre-eligibility criteria, aside from yourself, a legal spouse, a domestic partner, and children up to the age of 26. The benefits that you will enroll in are effective January 1 until December 31st, 2021. During that time period, you cannot make any changes unless you have a qualified event, such as a marriage, divorce, birth of a child, adoption, loss of coverage. So you have 31 days from the date of that event to contact your HR representative and review your options and potentially make changes. I'm going to skip ahead because we have a lot of plans listed here, but there's only one that applies, and that's going to be the PPO 2000. So let's focus on this PPO 2000 here. That's the plan that applies to the group. So this is the only plan option that is going to be available. So the PPO 2000 is a $2,000 deductible. And I'm actually going to bring this summary of coverage because that gives us additional information that is pertinent to doctor appointments, hospitalization, things of that nature. It's very important to note on this plan, when you have to worry about your deductible, it's going to be during major medical events. So if you go to the hospital for surgery, inpatient or outpatient, durable medical equipment, MRIs, CAT scans, that's when you have to worry about your deductible. Those events are going to trigger you paying towards your deductible or paying your deductible. So as an individual, your deductible is $2,500. As a family, it's $5,000. So it's very important to note that. And then if you meet that deductible, you then are going to pay 20% of charges until you reach the out-of-pocket maximum. So the out-of-pocket maximum is $5,000 for an individual and $15,000 for the family. Now keep in mind your deductible, your co-insurance, and all the co-pays that you have go towards the out-of-pocket maximum. And I apologize. This is your out-of-pocket maximum right here. So all your co-pays, everything goes towards your out-of-pocket maximum. So if you go to a doctor, scan your card, you can pay your co-pay for your doctor visit, your prescriptions, anything towards deductible, hospital visits, those all go towards meeting your out-of-pocket maximum. All of that goes towards meeting your out-of-pocket maximum. Very important to note that. If you have to go to your doctor's office, so this is going to be your regular physician, a walk-in clinic, a little clinic, a minute clinic, all those types of facilities, it's going to be a $35 copay and specialist $60. Now, during the pandemic, if you're able to schedule any of those visits virtually, which means it's going to be either a Skype visit, a telephonic visit with a regular doctor or specialist, it's going to be at zero copay until the end of the pandemic. So once the pandemic is over, you're going to go back to your regular co-pays for even your virtual visits and for regular doctor and specialists. But if you just need to do like a med check, a lab check, and you can schedule those virtually, it's zero copay. On this plan, all of your preventative care, so age-appropriate screenings, lab work, immunization, testing, that's all going to be at zero cost to yourself and anybody enrolled on this plan. So if it's yourself, a spouse, and a child, each of you get your annual exam at zero cost. Diagnostic tests, so this is where you're going to go in for a blood draw outside of preventative. The copay is based on where the service is rendered. So if you go to your regular doctor's office for a blood draw, you're going to pay the copay to that doctor visit. If you go to urgent care for x-ray, you're going to pay the urgent care copay. So it's going to be based on where that service is rendered. Your MRIs, PET scans, and CT scans are going to be subject to your deductible. Those are going to trigger your deductible. So this is going to talk about medication. So typically the pharmacies around town have the lower copay, $4 copay generics. On this plan, you're going to pay the lesser of. So it's either going to be a $4 copay or a $10 copay for the generic type drugs. Level 2 is going to be your preferred brand name drugs, and that's going to be up to a $35 copay. And then level 3 is going to be your non-preferred brand name drugs, and that's going to be up to a $60 copay. And then you have an additional tier, which is going to be labeled as level 4, which is going to be the same as a non-preferred, and it's up to 120. And if you're taking any specialty type drugs, you have 4 additional tiers under specialty. So in total, you have 8 different tiers under Blue Cross Blue Shield. If you need to know where your particular pharmacy falls, if it's a preferred, non-preferred, generic, or specialty, I do have the formularies that list the prescription names and what tier they fall under or what level they fall under. So if anybody needs to see that, if you have questions, please reach out to me and I will be happy to send it to you for review. On this plan, your emergency room services is a $250 copay. So emergency room, a couple things happen here for emergency room, and I'll just highlight it here. If you go to the emergency room and you have to spend the night, so a couple things may happen with that $250 copay. They're either going to take it from you and apply it towards deductible or waive it, and then you'll get a bill and you'll have to pay towards the deductible. Again, if your emergency room visit should only be for true emergencies. Keep that in mind. Urgent care is going to be a $75 copay per visit. And then everything else is going to be at coinsurance, the home health care, all these types of visits are going to be covered. Children's eye exams are also covered on this plan, and it's a $35 copay for those children eye exams, and it's 1 per year for the children only. You do have vision benefits that we'll get to here shortly. So the summary benefit of coverage that's attached to your invite has all the coverage limitations and exclusions. So this is a really good document to review if you have questions on how something is covered. And if you still have questions to your personal needs, please reach out to me and I can send an email to to Blue Cross Blue Shield and get those questions answered for you. So we're going to go back to the PowerPoint presentation and go over the rest of your benefits. So we're going to go over the flexible spending account. So the flexible spending account, you may have already received a communication towards it, which means you received an email earlier this month or last month in regards to your flexible spending account. If you haven't completed your enrollment form for the flexible spending account, this is a good opportunity to do so. And in the invite, you'll see documents labeled additional benefits. That's where your flexible spending account is attached. So this is what the form looks like for the task. Again, this is for the flexible spending account for the medical and dependent care. So the flexible spending account are pre-tax dollars that you put onto a spending card, and you can use those dollars to pay for qualified medical expenses for yourself, for your spouse, and qualified dependents. You may also enroll in this card without enrolling in any other benefits. So you don't have to enroll in the medical, you don't have to enroll in the dental or the vision in order to take advantage of these services. It is $2,500 max. It's available day one as soon as you get your card. It has a maximum of $500 carryover into the next plan year. What that means is if on December 31st of that current plan year, you have an excess of $500, you will lose those dollars. So keep that in mind. Also, if you leave the company, you do not take this with you. It is turned off and you no longer have access. The dependent care flex account, again, pre-tax dollars that you put aside to pay for qualified daycare or elderly care services. The money is deducted from your paycheck pre-tax, put into an account, and you may use those dollars to pay for those services or pay yourself back. Okay, Blue Care Anywhere. This is going to be your new telemedicine provider starting January 1 with Blue Cross Blue Shield. This applies to yourself and any dependent enrolled in Blue Cross Blue Shield. So you have access to medical professionals, board certified doctors, counseling and psychiatry. Until the end of the pandemic, again, for these services, they are at zero copay for yourself and any dependent. When you get your ID card, you get a welcome kit that's going to have additional information about how to access the care. So I highly recommend as soon as you get your ID card, registering and downloading the app to your telephone so you have that ready to go when you need it. So we're going to talk about the dental plans here with Delta Dental of Arizona. So no change in the plans or the premiums. Everything stayed the same. So the PPO base plan is your traditional dental plan that gives you an allowance to use towards your dental services. So in this case, it's $1,500 for yourself and any dependents enrolled on the plan. If you have any children, there's an additional $1,000 to use towards child orthodontia, and that's a one-time lifetime benefit per child. Preventative care services are going to be covered at 100%, and that's cleanings twice a year, sealants, space maintainers for the children, x-rays, those are all going to fall under preventative services. Basic services are going to be cavities and emergency services, and then everything else is going to fall under major services. If you utilize the basic or major services, you do have a one-time deductible of $50 as an individual or $150 as a family. And then the next plan is called the DHMO plan. On this plan, you do have to pick a primary dentist for yourself and any dependents on the plan. You may all have the same or different. On this plan, if you have children under the age of 8, they may see a pediatric dentist. And then once they're age 8 and over, they have to see a regular dentist. So keep that in mind when scheduling those visits. On this plan, there is no annual maximum and there is no deductibles. And your preventative is still covered at 100%. Again, your cleanings, your x-rays, space maintainers for the children, things of that nature, and sealants are at a small copay. Additional cleanings are going to be $45 on this plan. And then all other services on this plan are at a fee schedule. So the fee schedule is also attached to your invite, and it's a multi-page document that looks like this. So what you do here is you find the code associated to the treatment that you want to have done, and then the copay here is what you pay. So whatever is listed on enrollee pays, that's your expense. Now you can use your flexible spending account or FSA dollars to pay for these services, and you can utilize the plan as often and as much needed. It does cover child and adult orthodontia. The only thing that it doesn't cover are going to be implants. All other services under this plan are going to be covered. Now, if you enroll in this plan for the first time and you do not pick a primary dentist, there will be one appointed to you based on your home zip code. All right, we're going to go over the vision plan next. The vision plan, again, no changes here. So it's still with iMed using the Insight network. You have a $10 copay for your exams that are available every 12 months, and it is a rolling 12 months. So if you went on July 1st, 2020, you do have to wait until July 1st, 2021 to schedule your exam. Your frames are available every 12 months, and you have a $128 allowance to use towards those frames, and anything above that, you will get a 20% discount. And your plastic single vision bifocal or trifocal lenses are also at a $10 copay. Now your contact lenses are available every 12 months in lieu of the lenses for your glasses. You have an $80 allowance and then a 15% discount. Medically necessary contact lenses are always going to be covered in full. So I'm going to go over the life insurance, and I'm actually going to pull up the enrollment form because I've attached this to your packet. This is going to be for the voluntary life insurance. So if you enrolled in the Unum life insurance when it was first presented, it is changing to MetLife. So it is necessary to re-enroll in the life insurance. If you do not know what your coverage is today, please reach out to us and we'll be happy to let you know. Your HR contact here at CBR is Priscilla Martinez, and you can email her at pmartinez@cbri.com, and she'll be happy to let you know what you currently have as life insurance coverage. And if you're enrolling or continuing that same coverage, just fill out section 2 here. Now these boxes here says new enrollment and change of enrollment. If it's new enrollment, which means you're enrolling for the first time, make sure you check that box. Or if you're changing your current coverage, check this box. If neither applies, which means you're just keeping what you have today and rolling over to MetLife, do not check any of those boxes. Just come here, check the box, and type in here, keep the same, and we'll know to roll over that coverage, whether it be for you, a spouse, and dependents. If you're enrolling for the first time or increasing it, again, check the boxes and type in the amount that you want covered. Same is going to be with short-term and long-term disability. Those are also going to be moving to MetLife, and those are voluntary options. So you have the short-term disability and long-term disability. If you're enrolling for the first time, check the boxes. If you're keeping what you currently have, check the boxes and write keep the same, and we will know to roll those coverages forward. Also, if you're enrolling spouse and children, we do need their information listed. And then more importantly, the beneficiary section that's going to be in section 5. We also need to make sure that you update this information. So very important here. And if you are legally married in the state of Arizona, being a community property state, your spouse should be first, and then you can add whomever you want after that. Then we need a quick signature. Now your rates, if you're enrolling for the first time or increasing or want to know what it is, if you're keeping the current amount, there will be no change in the premiums unless you've changed birthday and now it ends in a 0 or 5. So that's when you go into the next age bracket. If that doesn't apply, then you should no adjustment on your paycheck deductions. The rates for the life insurance are going to be on this plan, on this 20-page document. There's additional information of the life insurance, what it covers. The guarantee issue is $200,000. So the guarantee issue, what that means is that is you can apply up to 5 times your annual earnings up to $200,000 without any medical underwriting, which means you don't have to submit any type of medical testing, answer any medical questions. It is guarantee issue for yourself. For spouse, it's $25,000, and for children, it's $10,000. And those are the guarantee issue amounts. Again, no medical underwriting. If you want to go above that, you may, up to 5 times your annual earnings, up to $500,000. Anything over $200,000 will require some medical underwriting. So keep that in mind. The same applies to your spouse. The children are always going to be at guarantee issue, so no medical underwriting there. So the rates are here on page 10, it looks like, of 20. So depending on your age and the amount you want covered, it's going to be the premium. These are monthly premiums. You may divide it by the number of paychecks in order to figure out what your per paycheck deduction is. Now, this is just going to be for the life insurance. You want to make sure to add the AD&D, or accidental death and dismemberment benefit, which is listed right below the spouse's premium. So you want to add it to yourself and your spouse as well. So this is the AD&D coverage. So you'll add the amount to the above rate, and that's what your monthly deduction would be, your monthly premium will be for the amount of coverage. If you're going to do more than $100,000 or up to $200,000, let me know and I can send you those rates. I'm going to go over the short-term and the long-term disability here. So again, it's changing to MetLife. So I want to go over really quick the rate and how to calculate that if you're enrolling for the first time. This is the short-term disability, so it's going to be based on your age and it's going to be based on your income. So this is the calculation that you use. You use this for your guide, the short-term disability, and then the same applies to the long-term disability. Again, you just follow the criteria here, the little calculation worksheet here based on your age, your income, and then that gives you your monthly premiums. And again, it's going to be based on your age. So I'm going to move forward here with the rest of the benefits, the short-term and long-term disability. Again, moving. The short-term disability here starts to pay at the 14th day, which means of illness, hospitalization. It does cover pregnancy, and it does have pre-existing limitations, which I'll touch on here shortly. So this 14th day, after the 14th day, it covers 60% of your pre-disability earnings that are going to be defined by your W-2 earnings, base, commission, and bonus. Pays up to $1,000 a week. The duration of the short-term disability is 11 weeks. And I'll go over the pre-existing limitation at the end. The long-term disability starts to pay after the 90th day or the termination of the short term. Again, 60% of your pre-disability earnings that are going to be your base bonus and commissions, and then it pays up to $7,500 a month, and it lasts until age 65 or normal Social Security retirement age. The pre-existing limitations. So if you're enrolled today in either the short term or the long term, you've already met the pre-existing limitation, so it shouldn't apply to you. If you're enrolling for the first time, and this will apply to you, it's called a 312. What that means is if you saw a doctor, took medication, or were diagnosed with a condition 3 months prior to the effective date, and you went out on leave in 2021 with that same condition, it would not be paid, it would be excluded for 12 months. So that's what the pre-ex means. We're going to go over the EAP, and I'm actually going to bring up a flyer here because I think, especially with these times, uncertain times, EAP is something that we underutilize and is available to everyone, whether they enroll in benefits or not. So it is with support link, and again, it's available to all the employees, whether they enroll in benefits or not, and dependents as well. So it gives you 3 face-to-face or in-person counseling Skype visits per incident, so you can call as needed. You have free legal services, expert referrals, so elderly care, adoption care, pet care, home repair. If you're new in a neighborhood or an area and need to find services, they can help you navigate that. Free financial services. They have a really good web portal that you can access that has self-help videos, classes, a lot of information to help you navigate through everything we're going through today, and just regular work-life balance. There's information here on how to access these services. You can scan the QR code, go to the website, access that. There's also a discount program available on the website. The username is going to be CBR, all lowercase. I'm going to go to the next benefits, which are going to be our AFLAC benefits. And I believe we have Jose on the telephone that's going to speak to our new and improved AFLAC benefits.
I'm here. Good morning, everybody. Thank you, Leticia. So yes, just to keep going through the overview of your benefits, we're excited to introduce the AFLAC offering this year. You have an opportunity to participate on a voluntary basis. What it does is give you an additional protection in case you or your family members, dependent children or spouse, go through a health event, whether there's a sickness or an injury. And what it does, AFLAC pays cash benefits back to you. So if you've seen the AFLAC Quack and Duck on the TV commercials, if you had AFLAC in the past, this current offer that we're doing for 2021 through CBR, it's our best offer yet. I'm going to highlight the 4 products that we're introducing. So you get to pick these on a voluntary basis. So you don't have to select any of them. You can pick as many as you're comfortable with. We'll walk you through it. The plans are owned by you. They're offered through the company, but you own them from day one. So these are guaranteed issued. And so if there's pre-existing medical conditions, we don't really care about those, but we do want to go over what each plan does and how they work. So you currently have an offering for your medical insurance. So if you have a copay and out-of-pocket medical for your deductible, say your annual total, out-of-pocket, if you do have an event where there's sickness or injury, AFLAC has products that will help you offset those dollars. So sometimes you get more benefits from AFLAC, and these plans are very affordable, and I'll go in detail on those. But let's start with the accidents. So if someone gets injured on and off the job, it protects you and the family, all the dependent children up to the age of 26. You can have a single parent, 2-parent, employee and spouse, or a full family coverage. The price on this one is around $4 a week for an individual, up to $10.40 for a full family, and anywhere in between if you're any other type of coverage. But what it does, say you have an injury on and off the job, you're hiking, you're ATVing, someone gets injured, a small cut, a burn, someone has to go to urgent care or has to be taken by ambulance or go to a hospital. If there is a hospitalization, the first night in the hospital, they're going to pay you $1,250 just for walking in and being admitted because of the injury. And then you get a $300 daily benefit for being any additional days up to a year, plus a $400 in case you're admitted to an intensive care unit. So that's a upfront in case of a severe injury. Anything else, like a small urgent care visit, you don't go to emergency room, you don't go to the hospital, you just go to like a 24-hour clinic, it's a $200 benefit. That one went up from last year's, was $120. So it's a richer benefit by itself. Any MRI, CT scans, any diagnosis or any imaging that you need is $200 for imaging. You get ambulance, you get urgent care visits. All of these are kind of your basics. So any type of small, you go get a couple stitches and get home, just paying the copay and maybe ordering pizza that night. That's, that could be on Aflac to offset that. If you have to get a babysitter, right? If you need to go out get someone to help you clean out, additional services that your medical insurance will not pay for, you can use the Aflac cash benefits for. The more severe the injury, the higher the benefits, the payouts. We do have an accidental benefit built into the $50,000. It's an accidental death and dismemberment plan. It's very rich, about 50 total benefits, and it does have a health benefit for a wellness. So once a year, you and your insured spouse will get a $50 wellness just for going to get a physical, your adult wellness, an eye exam. So that one is built in. Like I said, it's about $4 a week. The next plan is your hospitalization plan. Now, this is where you can take a look at sickness or injury. So if you're injured, you get a hospitalization benefit. If you are sick, this hospital plan will help out. Is guaranteed issued regardless of pre-existing, and he pays a $2,000 for sickness or injury confinement for you and each insured member of the family. So it's not a shared $2,000 for the whole family. Each person that is covered and they're admitted, they get a $2,000 benefit. So $2,000 for the first night, $200 daily for the next 30 days, and $200 if you do an intensive care for up to 10 days. You do have a $50 wellness benefit also per insurer, mom and dad. The kids on this one, again, the family coverage can be, this one starts at $7.65 a week for an individual, and it's $19.85 a week for the whole family. What we do with this plan is really to help you offset those deductible dollars when you are exposed. If you do have an event, you at least count with the $2,000 coming in from Aflac. Don't have to tap into your HSA if you don't need to, or you can use the Aflac dollars to, like I said, pay for any out-of-pocket medical that is not covered by your doctor insurance. The next plan is your critical illness plan, and this one we're very excited about. It is the best of both plans. We've had a heart attack, stroke, coma, paralysis plan separate, and that's a critical specified event. And then we have a cancer protection plan. It pays for any, initial diagnosis and pathology and ongoing treatment. What they've done with this one, they made the best of both worlds. They enhanced the product, they combined the products, they blended them, and so pay a bigger amount. The biggest amount I've seen is $30,000 as a lump sum upfront, up to $30,000 for you as the individual coverage, or you can get up to $15,000 for your spouse. Dependent children are covered up to 50% automatically of whatever you participate on. It is age banded, and it does have 100% payout to you, 50% for them. You can select $15,000 or $30,000 for you to start up, and then anything you pick, they can get up to 50. So, give you an example: a young person between the ages of 18 to 40, they're not going to spend more than $2.88 on the low end, up to $6.30. Anyone a little older, like myself, in the 40s, so we're going to go 40 to 55. We're going to spend around between $8 to $14 a week for the high 30,000. So it's a very unique offering. We like this one a lot. That's wellness benefit of $50 for your spouse once a year for the adult wellness. 3 plans that I mentioned: accident, the critical illness, and the hospitalization will pay back just for getting the same preventative annual physical, annual checkup. So that's a very good incentive on that one. We do have a short-term disability, and Leticia will go over the difference on the MetLife. We do have a customizable short-term for 3 months or 6 months for 0-7 or 0-14 elimination. What that means is we'll start paying the first day of the accident right away, 0 days of elimination for waiting on that, and as early as 7 days or 14 days after your sickness. So that's a very customizable plan. We can go up to $4,000 of your paycheck protection on a monthly basis for 3 or 6 months. It is guaranteed issued. This plan is, you can select less of the amount that you want, and if you, you own the plan, so it's portable, and you're locked in at the youngest age, 10 age right now. So all of these plans are, this plan is by itself, the short-term is just only for you, not for the family. We do have an enrollment form. Technically, we want you to, fill this out, and I'm going to send out an email with the attachment after, just to follow up with the new code for the time trace schedule. If you want to set up a scheduled time to talk to us between now and the 18th, that'll be next Friday, we can do the open enrollment for you. If you had the Aflac plan, there is a conversion. We do want to compare both of the old plans versus the new offering to make sure that which one you're picking up, and then make sure it's the right fit. And then just let us know. So I'll open it up for questions. Anyone on the call that may have a question about the Aflac plans? All right, Leticia, I'll let you wrap it up.
Thank you, Jose. I do have a question. How is COVID covered, like let's say under a hospital plan or
Great question. Good question. So these plans will be effective January 1st. So anything that happens after January 1st, if you have gone through testing or prior to January 1, that's okay. If you've been diagnosed, that's okay. It's when you get diagnosed and treated after January 1 for any sickness. So it could be COVID that you get, plus you get paid the $1,000. So you don't have to wait. There's no elimination. That's not pre-existing. So that will be covered. You see the benefit if you're hospitalized after January 1 because of sickness. With that said, this one, if you're currently in a family or your spouse is currently pregnant, or yourself, don't know, if anyone is pregnant is going to go through a childbirth and after January 1st, go ahead and look at this plan, because it's going to pay you the $2,000. It covers mom automatically. If there's any, heaven forbid, a NICU situation, the newborn will become immediately a new cover patient. They'll also get separate coverage on that. So they're both covered. Just let us know the first 30 days of birth. And what it'll do is it's not pre-existing. The old plan needs to exclude that maternity childbirth, but now it's not. So great plan if you're currently pregnant, mom is going to be in the hospital. A good plan to give you $2,000 coverage for that one just because of that. So great question. So any sickness, COVID, any sickness is protected, including any existing.
Thank you, Jose. I also just want to point out as well, if you have Aflac today and you went to get a wellness, or you had any events in the current year and you have Aflac today, Jose can also assist with maybe navigating through a claims process, submitting claims. Also, if you have the plan today or next year, and you have an event that you go to the telemedicine, like an accident, those can be also submitted as long as you have proof of that doctor visit. Is that correct, Jose?
Correct. Yeah, we do have a wellness. If you've been enforced and you haven't filed for it this year, we can help you out. Even if you had it prior years and you forgot to do it, let me know. I'll send the wellness benefits as long as you have a date that you, and then for future dates, same thing. You don't have to wait. So if you go with your physical early in the year next year, that same coverage for all three plans. So these are a la carte cafeteria, so you don't have to pick all of them, but if you pick 1, 2, or 3, and they have the wellness, you're gonna get paid that for the same date on all three of them. So we don't coordinate with any other coverage, and we don't coordinate with your medical, we don't coordinate with ourselves, so we'll pay both of them.
Thank you, Jose. So I'm going to end
Awesome.
I'm going to end with a couple more voluntary benefits that are available to all employees. So one of them here is going to be the Legal Shield and ID Shield. So the Legal Shield is a suite of attorneys that you have at your disposal for a multitude of things, that you may access an attorney for: standard will prep, consultations, legal document review, contract review, and they do have emergency assistance available. You do have to enroll online on this service. Here are the rates for yourself, family, for one or both services. The second service is going to be the ID Shield. So that is ID protection, identity theft protection. So they monitor your credit, the web, including the dark web, to make sure that your information is not out there and being used by someone that's not supposed to be using it. So good benefits there. And then finally, the pet health care provided by United Pet Care. So this is, veterinarians throughout the valley that contract with United Pet Care to provide you savings on your veterinary needs. You do have to enroll online on this program as well. It is payroll deducted. and you will review. So when you go to the website, and I'll just go to the bottom here really quick, this is the website you go to. And initially you want to start with your zip code to see what veterinarians in your zip code are already participating in this program. It's $11.66 per pet. This is the one that I pay for. I have one dog, and then these are the services that I take advantage of. So the office visit is $40, and that's going to be the annual exam that's going to provide the immunization, the rabies shots, and then she also gets an allergy injection or allergy medication, and it's a really good discount. I didn't realize how expensive, you know, prescriptions were for pets until I knew my dog needed it. There's no pre-existing limitation on this either, or no breed exclusion. It covers dogs, cats, pocket pets, ferrets, reptiles, so really good savings here. That is all I have. I'm just going to bring up the enrollment form just to close it out and ask that everybody complete or an enrollment or a waiver. That's all we need, an enrollment or a waiver from everyone. Fill out the pertinent information, the boxes that apply to you. If you are enrolling dependents, we do need names, date of birth, gender, and social security numbers. We are required to collect that information, so please fill that out. Reach out to me if you have questions on how to fill out the form, if you have questions on pricing for the voluntary life, pharmacy information, just send me a quick note and I'll reply with the information that you need. Priscilla Martinez, also here in our office, can assist with what current coverage you currently have. If you're you have a voluntary life or short-term or long-term or AFLAC, we can assist with that. So your current benefits that are with United Healthcare will terminate on December 31st. They will not renew. So you do have to make a plan selection or a waiver, and you can enroll in just the dental or just the vision or just the medical. All the benefits are a la carte. So any questions from anybody? Oh, and finally, we do need everything back by December 16th. So that's going to be the due date. And I believe I put that in the email. Yes, December 16th, and everything back to Priscilla Martinez. Any questions?
I think we're good. Thank you so much, Leticia.
You're welcome. And I'll go ahead and send you the or send the YouTube link on the same invite so everybody has access to it. And I know Jose is going to reply all as well and provide additional information.
Perfect. Thank you.
Thank you so much. Feel better, Blake. Take care.
I appreciate it. Yep. Bye-bye.
Bye.